Thank you so much for tuning into Facilities in Focus. My name is Mackenna Moralez, and I am the managing editor of FacilitiesNet and your host of this very podcast. It is such a pleasure to be a part of your journey on the internet. To continue on with our healthcare facilities theme, today I am joined by Yanet Vega. Yanet is the Director of Facilities and Environmental Services at El Rio Health, one of the nation's largest federally qualified health centers in Tucson. In her role, she leads operations, environmental services, transportation, and capital projects across a multi site healthcare network, creating safe, patient centered environments. With a background in architecture, Yvette brings expertise in design, space planning, and interior design, helping streamline projects and align facilities with clinical needs. She is widely recognized for her collaborative, people first leadership and for championing women in facilities management while supporting local vendors and strengthening community partnerships. Thank you so much for joining me today, Yvette. How are you?
I'm good. Thank you for having me.
Good. So, as I was pitching you to come on to the podcast, I mentioned how I went to ASHI's Healthcare Innovation Conference last summer, and where were we? We were in Columbus, and one of their keynote speakers mentioned about how healthcare is a really unforgiving job. Can you just explain how compliance directly impacts patient safety, even in ways most people wouldn't immediately see?
A quick break to thank our 3 Season 5 sponsors, ABM, Orkin, and PointCore. Here's a quick message from all 3 sponsors. Healthcare facilities are demanding environments. Thankfully, ABM provides peace of mind with IAQ, efficient HVAC, and tech-enabled predictive maintenance. Learn more at abm.com/care. Pests hate us. Businesses love us. Orkin helps keep your facility ahead of pest pressures with practical, proven protection tailored to your needs. This episode is brought to you by PointCore, delivering facilities and construction solutions for healthcare that help organizations strengthen performance and support exceptional care environments. And now, we'll get back to the Facilities in Focus podcast.
Compliance is patient safety even when it's invisible because patients don't see testing done. They don't see the backflow testing, fire inspections, or any monitoring of any device. That's important to be able to protect the patients. And even though they don't see it's a major factor in healthcare because that could potentially lead to closing a building or somebody getting hurt. It's never going to be immediate to the eye, but it's just behind the scenes that it's important that it's done.
Right. And I feel like so much about facilities management is being behind the scenes. Can you just touch on what that looks like in healthcare?
Yes. So in healthcare, the goal is that we don't disturb patients, we don't disturb staff. So things are always asked to be done. Can you do it after hours? Can you do it when nobody's here? Can you come earlier? Can you accommodate us? And that makes it hard, but it's the best way to try to approach it because we don't want to be disturbing, making loud noise, or making it visible that an environment is not safe. So doing all the behind the scenes makes it, or at least the perspective of, okay, you're coming in to get a service, but you're not worried about watching things fall down or watching things being completed.
And what does after hours even look like in a place
So,
like healthcare?
so it depends on the setting. For example, the work I do is outpatient services, is federal qualified health centers. And after hours for us looks like doing it work from, let's say, 10 p.m. to 6 in the morning, that block of time. So
So late.
we have to work with technicians to work there with plumbers, electricians, whoever the vendors you're working with is kind of trying to figure out what makes sense for them to do, or if there has to be deep cleaning, like floor and strip waxing. That crews work overnight. So then when you come in as a patient or as a staff, everything looks nice and ready to go
Right.
versus you having to accommodate. And sometimes it's hard to accommodate after hours. So there's times where you do have to work during business hours, and it's just being mindful of having safety cones, communicating with staff, communicating with patients that there's something work going on, trying to isolate the area so then it doesn't affect any work and operations.
I know this is kind of a silly question, especially because we are in the year 2026 and we have electricity. But when you do this after hours maintenance, does the lighting have any effect on this?
The buildings work as if it was during the day, and you follow the same procedures. We don't turn off the lights, turn off the water, do different things. So everything is treated in the same capacity, and it doesn't
Yeah.
affect anything in the building.
But from your perspective, what's at stake if a facility starts to treat compliance as a kind of check the box type of exercise?
When you do a check the box, you miss opportunities because you're just focused on the code says do not install this 18 inches above the ceiling, or the code says you have to have a 2-foot clearance. So you're just looking at exactly the wording and following that format versus looking at the whole picture. Sometimes you could be doing an inspection or checking the box on something, but there's other things that you're going to miss because you're so focused on just doing list by list items.
What is something that is like commonly missed when it comes to compliance?
The thing I see the most is communication.
Okay.
So people often, when things are fixed or they need to be fixed, people don't always communicate effectively. And from a user, if you have issues with a light in your office, for example, you should communicate right away that the light is not working so it could get fixed right away. And on the technician or the vendor who's fixing something, once it's complete, they should communicate back. So then communication happens with the user. So then you know that the light was checked by an electrician or by a technician. If it had an issue, it was fixed, and now you're aware and you know you're in a safe environment. So I feel that there's always gaps in people care and people want to help and do their work, and safety is the most important factor, but that gets missed when people don't communicate effectively.
Right. And now I feel a little called out, I'm not gonna lie to you because when my son was in the hospital, he was a NICU baby. There was a light in my hospital, in the bathroom of my hospital room, that just flickered the entire time I was there. And instead of saying like, hey, I think you guys need to fix this, as like a facilities management journalist should do, ignored it. I just ignored it. I was like, this is the least of anyone's problems right now. But like in a healthcare facility, you don't know what type of issues people have or medical, not issues, excuse me, medical conditions someone may have. And something as unnecessary to me as a blinking light can have a detrimental effect on someone else. And I'll be better next time, I promise.
I guess like a flickering light could also trigger a condition if somebody is triggered by sensors or lighting. That could also be a factor in safety. So it's important, and not just for to see the light and create a safe environment. It could be other implications. So
Yeah.
we learn new things every day.
But I'm glad that you mentioned communication. And I've said this a bunch of times on this podcast that people think that facilities management is a pretty solitary career choice. And I can't think of anything further than the truth. You are constantly talking to people, working with people, just around people, because that's just the nature of your job. How do you stress the importance of communication to your staff?
To me personally, communication's everything, because when you're working with construction, safety, patients, with something that's so big, it's everybody's time and it's money. And it's not something that you could just say, oh, I'm sorry, because I'm sorry could cost millions of dollars, or I'm sorry could cost lives. So it's important that to understand, for my teams to understand that, and also to understand that everybody is not in facilities. People
Mm-hmm.
think something gets broken and you fix it. So the reality is anything could go wrong. And yes, you're there to fix it, but most important to create safety. And so understanding that and relating that information, that everything that my team does and people in this field do is for to serve a purpose, and to understand that the people that we're working for, essentially our customer base, our clients, they don't know how this works. So it's important they understand, oh yes, if you complain it's too hot in your office and the temperature gets fixed, it drops, to give them an explanation of the outside factors into the AC. When the weather changes drastically, it could be set at a certain temperature, but everything affects it. We often get, oh, there's a smell of gas somewhere, and the building has no gas. But because the airs come from different areas, it could
Mm-hmm.
be a building next door creating a smell, and it comes this route. So educating and communicating what's happening, even if it's not something that you understand, then it gives you the ease of, okay, this is what it is and this is what was
Mm-hmm.
done.
And you're constantly learning too. And
Yes.
I think that's a really interesting part about facilities management because again, all the misconceptions that come with working in the trades, you don't go to school, that means that you don't have to learn ever again. And that it couldn't be for again further from the truth in this
Yes.
career. And because you're just always, like you said, finding new things, figuring out solutions.
There's always something every day and something different every day.
I'm also glad that you mentioned the financial part about compliance because I know that we don't want to think about healthcare facilities as businesses. That is what they are, though. Yes, they are in the business to save you, protect you, heal you, but they also have to make money somehow. Beyond safety, what are the financial or legal consequences organizations face when they aren't compliant?
You could run into potential fines, losing accreditation for the services you're providing. It could impact the reimbursement you get from whatever grants or government, whatever things that you're doing, and the liability that you could have for not following the proper channels could potentially be a big issue, because they could force you to close the organization down. And so then it doesn't become a facilities issue, it's more of an organizational risk.
Hmm. And then when you lose accreditation, does that usually mean that the facility has to close down, or is there some type of trust issue there that people aren't as willing to go to you?
In order to provide health services, you have to follow accreditation from certain entities. And if you don't comply with those, then you can legally operate.
Oh, okay. Thank you for explaining that to me. I mean, that does make sense. How do you keep up with these evolving requirements?
It's a combination of many things. It's reading, it's going to conferences, is connecting with vendors, is connecting with industry professionals, networking, and then using the company, the internal teams, compliance and risk. We work hand in hand with them. And so they understand a lot of things that need to be followed. And so using your resources to make sure that we're keeping each other informed and understanding how the times are evolving.
I feel like things are evolving so fast. I just lost my train of thought. That was such a good way to put it because, as you know, and when the COVID pandemic happened, things rapidly innovated. I think I mentioned it here on the podcast. Otherwise, I have talked about it a lot in my personal life that in the first 3 months of the COVID-19 pandemic, we saw 3 years of technological innovation. How did that kind of look from the healthcare facilities management side?
For certain things, I think it's a plus, like trying to find resources, sharing information, having platforms where you could have documents, drawings. That with all the innovation that's happening makes it easier so people could get the resources. But at the same time, I feel that that's happening fast. And sometimes because I feel like healthcare it's kind of slow in a sense because there's a lot of things that have that, like you said, mentioned COVID earlier, that was a change that happened in healthcare, but healthcare works at a certain pace that I feel that when different innovations are coming, you have to kind of get with the trend and figure out how that best works with your team, with your policies, and the way the culture is. So it could be good and it could be bad, but it's understanding how to navigate that.
What kind of trends have you seen in recent years?
With technology and stuff like that, I've seen more of different applications, like I said, for sharing documents that have been that are out there to make things easier because we're so heavy now on social media and technology in that sense. So
Right.
there are more opportunities to be able to create faster environments. And for example, for like HVAC systems to keep temperatures in buildings, it has gone more into now you from the engineers and technicians on the team could go on their phones and adjust temperatures. They could troubleshoot and see if there is something in the mechanism that's not working. So that's life changing in that sense.
That's interesting that you bring up the social media aspect of it. And I think a lot of people obviously use social media for their own personal uses and just to keep connected with other people. But I know a lot of people use social media to complain. And have you ever had a social media response that made you improve your facility?
I haven't experienced that, but I'm sure that
You're like, but
that
now I will.
yeah, that could happen, but it's everybody has a unique perspective in what they bring, and having different backgrounds and different experiences, I feel it's more of sharing each other's experiences. And
Mhm.
like when you're a parent, you take what resonates with you when other
Right.
parents give you advice.
Right.
So I feel that in the facilities healthcare world is the same. You could learn a lot from each other and use whatever works for your needs.
What a positive way to spin that question. But to any of our listeners, if you had a social media response that made you improve your facility, email me, comment on here. And now I'm curious if that has ever happened to people. Let me know. Because I think there's so much power when it comes. Now, this is where I'm going to be a little bit of a zillennial, but there's so much power that comes to social media. And I think that is another tool. We talk about how AI is a tool that we need to keep in our tool belt. Social media is one of those things too, because some people just aren't brave enough to file a grievance or actually make the complaint, like you said, about accommodations not being great. They'll take to social media because you're more brave behind a screen. And so I mean, maybe not, don't always do it, protect your mental health in some ways, but scroll, look up your facility's name, see what people are saying about it, and see if there are ways that you can improve. It's like an informal survey.
In my experience, We haven't had so many social media, but we do get feedback through patients and staff, and we
Mhm.
apply the feedback in when received. It's
Yeah.
important to understand everybody's perspective and anything we could do to better our buildings and our experience for everybody who enters those buildings.
What do you think is some of the biggest misconception facility managers have about regulatory inspections?
That the goal is to just follow a list, like we talked about before, the checklist. The goal is
Mhm.
let's be ready when an inspection comes. In healthcare, you could have an inspector show up out of nowhere from
Mhm.
5 different entities. So that's a misconception to just instead of people think, oh, an inspector is coming next month. So it's kind of like you have a month to do everything you need to do. But the way I see things and the way I talk to my team is we're not preparing just for an inspection. We have to be prepared every day. So
Right.
we don't take it in that way like, oh, we have a month, we have 2 months, we have a few weeks to prepare. Every day is preparation. We wake up and we work in this industry, and our job is to create safe environments for ourselves, for our teams, and for the people that come and get served. So that mindset, it's good to change because then you're always prepared, not just for when somebody will come.
How do you go beyond like your own checklist? Is there something that you always try to improve that's not like a set standard?
Um, yes. So besides the regulations that are by the different organizations that are followed, I, for example, will visit sites and look at other factors or if I see for example, a space is designed a certain way, then you have your requirements, but people follow different patterns and they
Mhm.
might use the space differently. For example, sidewalks. You're supposed to go on the sidewalks. We have people that um, fall because they're cutting through the landscape, because they're
Right.
doing things that they shouldn't. So then when we observe these things, we look and we're like, what can we do to understand the patterns people are doing, even though they're not part of a checklist or some type of regulatory item that we need to follow. So then I ask my teams when you're on site and when you see things, take note of what that is and let's work together to try and fix things before they become a safety issue or they become a financial risk for the organization. So
Right.
it's seeing it in a different lens where
Mhm.
you're following, you're looking at the whole picture versus just written written laws if you say that you have to follow.
What is something that you never considered until you lived it?
Um, People always talk about having common sense, and what's common to me is not common to you. What's common to users is very different. So a lot of the things that I deal with on a day to day, to me, is common sense. Like I explained the sidewalk. If you're
Yeah.
going through pebbles and through areas that you shouldn't and you have an accident, you kind of, that's not something that was created that way, but then it becomes now I have to fix it. So to me is everybody thinks different and everybody's common sense is not the same. So it's understanding that and thinking in that way.
Mhm.
What could happen that in a different way? And so when I work on all my projects, I always bring up all this stuff and then they look at me and I say, those things happen. So we just have to prepare before they happen. But
Yeah.
I never thought about that until working in this field, that it's just, it's not the same for all of us.
Unfortunately, we do have to think some people are dumb. And it's not not like the best way to live our lives, but there are some people that prove us wrong and that we have to have certain things in line.
There's people say, "Oh, is there a dumb question or is there anything could happen?" So you just have to be prepared.
Right. Because sometimes you just gotta think everybody is like a little toddler. And maybe it's because I have a 2-year-old at home who is just like wanting to, it's his first time in life. He's learning everything. He wants to test all these boundaries. That doesn't stop as you get older. Like we said, there is continuous learning in our
Yes.
industries, and people are going to make you learn whether you want to or not. But what are some of the biggest challenges facility managers face in maintaining compliance across complex healthcare environments? We did talk about common sense, but what are some other issues?
Um, the people not understanding the risk. I might show up to a site and people have all these decorations, all this stuff, and there's not a clear path. To them, it's, oh, I have my space in an office or in an exam room, and I have set it to be welcoming to me. But
Mhm.
then they don't think about how that becomes a safety risk. And so when I meet with people and I see something like that, I explain, oh, I can't say you just can't have it like that, because then it's like, oh, why can't I do that? So it's more of making them see how it connects to them. And I explain, if you have this item here, if I was bringing in a patient in a wheelchair, they wouldn't be able to come in safely and come out of your room. If you have this covering the door, if there's a fire, you might get trapped and somebody could die because it's that serious. So explaining things in real live events where somebody could understand, then it makes it a different outlook for those people. And it's not just a bunch of rules that you're trying to follow.
Right. And like I mentioned before, this is an unforgiving job because if you mess something up or if people aren't listening to you, someone may die. And
Yes.
how can you ever move past that over just like one mistake because you weren't feeling like being compliant that day? I think people's lives are worth a lot more than that.
Yes, that's why it's the hardest part is not overwhelm people with, oh, there's all these rules, because they're not going to care there's all these rules. So it's making sure you are sharing and you're connecting to real experiences and not over explaining it, but making sure they understand that it takes everybody to communicate. It takes everybody to do their little part to make sure we keep a safe environment. And like raising a child, it could take a village to do that. So it's the same
Yeah.
in the healthcare world.
I think that's a really good way to put it because when you're a parent, you're in charge of these little people, and you need that village to help raise that little person. And healthcare is the same way. Like you want people to thrive in it, and you have to work together to do so.
Yes.
It's a reason why it's a care team that you have.
Yes.
And facilities fall in your care team. And I've spent a lot of time in hospitals these last couple of years, so I know how essential that role is.
Yes. And so understanding that, and everybody who's in charge of keeping a building safe, if they're safe, then they could provide that care, that high quality care, for when anybody comes in through the door, they're in a safe environment and they're contributing to more than the care itself, but in the environment they're at.
Right. Do you get a lot of pushback from people about this?
Yes. That's
Really?
that's why I mentioned that it takes a village to do stuff, because people don't understand the implications of what's if something goes wrong, what it could cause, and they're like, I don't understand, why can't I just do this? And it's until they get educated and they're willing to hear why, then that resonates with them and they will not ask in the future, because they understand, if we can't do something, it's not because I don't want to do it is not because somebody doesn't want to help, it's because we want to make sure they're safe and they provide that safety environment to everybody they come across.
Maybe I am just a pushover because if someone said at one time, like, someone could die, I would always do it by the book, even if it takes like the longest way possible. I would not be making shortcuts. But I've also have said a thousand times on this podcast, I'm a huge scaredy cat. And so I'm also a rule follower, I guess.
No, like there's nothing wrong with you not caring about other stuff because not everybody cares about everything. But safety, buildings, everything, it's not just you, that affects everybody. So
Mhm.
doing your little piece in the world, like being kind in the world, it comes a long way when we're all kind. We do little things. And it's the same with safety. We do all our little things, we all maintain our safety and we provide safety for others.
Right, because one day you might be a patient
Yes.
and you don't want to have your health at risk because someone was just feeling lazy that day.
Yes. So it's really important.
Yes. And then, I know that we are running a little short on time, so I just have one last question for you. If you could give one piece of advice to someone in health that is new in the healthcare facilities management, what would it be when it comes to compliance?
I would say don't treat compliance as a task or a checklist. Treat it more of as a system and learn how everything connects, how the people, the processes, vendors, how documentation is important, and building relationships early because compliance is never done and it's not done alone. It takes, like I said, it takes everybody to help and do their part to continue those services. If you follow a checklist, you're done. But that's not the reality of this industry. So so like I said before, it takes the village to do this.
Right. And there's nothing wrong with going above and beyond.
Yes.
But thank you so much, Yanet. Is there anything else you would like to add?
No, thank you for inviting me and for your time. I appreciate it.
Oh my gosh, thank you. Thank you for listening to the Facilities in Focus podcast. Facilities in Focus is a product of the facility market, which houses FacilitiesNet, building operating management, facility maintenance decisions, and healthcare facilities today. Thank you to our sound and video editors, Paul Ellertson and Johnson Delapet. Thank you to Morgan Johnson for designing our logo. Thank you to Dan Welton, Dave Lubach, Dan Hounsel, Jeff Forden, Elena Myers, Corey Lallo, and everyone else at Trade Press Media Group. And of course, thank you, Dalton, Holden, and Baby Girl. It's always a pleasure to be a part of your journey on the internet. For comments or if you are interested in being a guest on Facilities in Focus, please email me, Mackenna, at fnpodcast@tradepress.com.